So this week, I'm going to talk about urinary tract infections, commonly known as UTIs. This is a bacterial infection that occurs on the urinary tract, where bacteria colonizes, causing the infection. We see this more commonly in females because of their urethra being shorter compared to males. They can be categorized into two different categories, which one is uncomplicated, which involves the lower urinary tract, and complicated, which involves the upper. Uncomplicated are usually acute, sporadic, or recurrent UTIs in non-pregnant women, and then complicated are in men, pregnant women, or people with functional abnormalities of the urinary tract. Up to 50% of women can experience a UTI in their lifetime, and 40% of them have a recurrent rate of UTIs. And UTIs only occur in 0.1% of men. So some signs and symptoms of UTIs. So for uncomplicated, you have frequent or urgent urination, dysuria, subpar pain, cloudy urine, nausea, altered mental status. For complicated, you'll have all the same symptoms of uncomplicated plus fever, chills, and then flank pain or tenderness. So some risk factors are young, sexually active females, older women with hygiene issues, type 2 diabetes, inactivity, urinary retention, urinary tract malformation, pregnancy, and then in men if they are uncircumcised. So a couple ways to diagnose UTIs. First, with clinical history. So asking them if they've had previous UTIs. If they present with those same symptoms, then most likely it's a recurrent UTI. A urinalysis, which they can look at the amount of bacteria in the urine. So if there was 100,000 organisms per milliliter of urine, that could be a presence of a UTI. And then if they have an obstruction, they can either use an ultrasound or a retinal scan to diagnose that way. Some treatment, pretty common, just using antibiotics. And then for PT implications, we're just trying to educate the patient and how to prevent it from happening again. So staying hydrated, obviously they can track that on their own by just looking at their urine after they go to the bathroom, seeing if it looks hydrated or not. Perineal hygiene, so just making sure they know how to clean themselves the right way to prevent UTIs. And then for females, using something like topical estrogen has been known to help with prevention of UTIs as well.